In this ESMO, we had several interesting reports about melanoma. One was the adjuvant trial from the German group, the ImmunoNet, which showed the like in the patients with stage 4 resected with no evidence of disease, the combination of ipilimumab and nivolumab showed really an amazing important impact and difference compared to nivolumab or placebo. This is something that probably in the future can also change the practice for this kind of patient. Yes, the price to pay is toxicity, but 70% of patients still relapse free at 2 years. These are high risk patients, stage 4 with no evidence of disease, maybe something really interesting. The second interesting data came from the 067. This is just a confirmation that at 5 years, we have now 52% of patients still alive with the combination. This is the confirmation of what about we are saying sincere that we can cure the 50% of patients, melanoma patients with metastatic disease. We got also negative results from the INSPIRE 170, the combination of MEK inhibitor, Trametinib, and Milan compared to Pembrolizumab. Unfortunately, the results were negative. And then some interesting poster that we discussed in last year during the, last day during the poster discussion. Two interesting combination. One is the T-VEC plus Ipilimumab compared to Ipilimumab, phase 2 randomized trial. Interesting progression-free survival. T-VEC plus Ipi was superior to Ipilimumab alone. Median PFS 13.5 compared to 4 months of Ipilimumab alone. Hazard ratio 0.78. Interesting, but in terms of overall survival, still the curve seems to be similar. The problem is that probably in the Ipilimumab monotherapy, looking to the post-progression treatment, more patients were treated with other therapy. It is interesting that more patients were treated in this arm with monotherapy with T-VEC at progression. So we can say that this curve we have the combination and we have the sequence of Ipilimumab and then T-VEC, and the question is still we really need to combine if we can get the same benefit in terms of overall survival even with a sequence. So we'll see, but probably the most interesting data will come from the MasterK 265 T-VEC plus Pembro compared to Pembro alone that will clearly define the role of T-VEC in combination with PD-1. Lastly, the triple combination of the Dabrafenib, Trametinib, and Nivolumab, the Trident study, interesting study, open label phase 2, small number of patients enrolled, but in this trial allowed the enrollment of patients with brain met who previously failed anti-PD-1 therapy. And if we look the patient's characteristic, 16 patients out of 26 patients enrolled were PD-1 refractory, and with 9 patients with brain metastasis enrolled. So the data are, of course, really preliminary, but looking also the other characteristic of the patient population, with more patients with the elevated LDH, also with more organ involved, it's interesting the response rate that is 100% in the patients PD-1 naive, and 83% in the patients PD-1 refractory. That is good. And also looking to the median PFS in general is 8 months, but in brain met it's similar if the patients had brain met or not, with or without brain met. It was about 8.5 months. It is interesting. And also the overall survival seems to be interesting in this group of patients. And again, in the patients who were PD-1 refractory, we got interesting 8 months of median progression-free survival that is interesting for this kind of patients. The safety profile was consistent with all the other, but there was no death treatment-related, and mainly the percentage of discontinuation was lower to the 40% that we have seen in Keynote 22. Was 12%. And one of the comments of the author that is interesting, the early treatment stop for toxicity was helped to manage this kind of toxicity, because then with the dose reduction, no patients discontinued treatment permanently. So this will be interesting, this trial, for this aspect, and because probably the role of the triplet combination is more for the patients with brain met or the patients who progressed after an anti-PD-1 treatment.